October, Breast Cancer Awareness Month. It's an important time of the year, but for I.R.S, the nonprofit foundation that actually dedicates its entire mission to breast cancer awareness, support, and education, every day is Breast Care Awareness. And I'm very proud to have with us today Morgan Hare, who is one of the co-founders along with myself and our good friend Genty. And tell us about I.R.S and why it's making such a difference.
Well, really to sort of take a step back is we wanted to do something to give back.
Right.
And I wrote to you and asked what's something that's related to women that no one's talking about. And he wrote back to me and said up to 70% of women who have mastectomies due to breast cancer or genetic mutation don't know about their reconstruction options, and they don't have the funds to meet their co-pays or have no insurance. We realized this was a huge problem for the underserved population, and that's why we got together and formed the Alliance in Reconstructive Surgery, so that we could educate women about their reconstruction options, and if they couldn't meet their co-pays or have no insurance, we help pay for their surgeries.
Yeah, so you're educating, you're supporting, and you're really helping these women that actually have these incredible procedures, mastectomies, to actually have options for getting the best breast cancer reconstruction available. And we do it all around the U.S. And before COVID, I mean, we could do so much, but COVID has been a challenge for our fundraising.
Right. It's, you know, I think what people forget about is this is a huge mental challenge for a lot of women.
Yeah.
You know, they sort of get very depressed over this. So helping women and having a support system like our advocates is really great for that. And also diversity of the women we help and helping the underserved population, which is really important because these are the women no one talks to, and we talk to them.
Right. No, it's amazing. And our team is unparalleled. The compassion and some of the letters that we get after they've had their surgery, when we help fund them or partially fund them, it's just, it's heart-wrenching. It really is. I mean, but it's been so fulfilling. I mean, we have helped so many women all around the USA.
Right.
And of course, we're concentrating on the Southwestern Texas, but we've had patients from all around the US. And I want to thank all the plastic surgeons that I've reached out to that categorically have gone and said, listen, we'll help you. We'll do it for the underserved. For those that have that don't have enough insurance, we'll take care of it. We'll do the surgery. We'll do the flap. We'll do the expanders. We'll do the reconstruction, because they are physicians, and part of being a doctor is giving back, and that just makes me glow internally. And I just want to thank all of you for doing that. And I.R.S is one of those amazing foundations that really not only gives back, but it cares about all the people we take care of. And Morgan, congratulations to you. I know you spend an inordinate amount of time on it every day.
But it's really important to all of us that we help women.
Yeah. So how do we do this? What can people do, and especially in this month? What can they do?
Well, one thing to do is make sure you, if you're a woman, get your mammogram, because that's really important.
With an ultrasound.
Right.
Because everybody, almost every woman has dense breasts, and so I always tell my patients, get an ultrasound with your mammogram.
Right. And
demand it.
And they must tell you now if you have dense breasts. And the problem with dense breasts is they hide tumors because tumors are dense.
Right.
Always make sure on the first of the month that you do your own test and test your breasts and make sure that you feel them. So, because many women find their cancers by themselves.
Yeah. So the breast self-exam is important.
Right.
Annual mammography with
really important. And as soon as you notice any change in yourself, whether it's something you feel, if your breasts are expressing liquid or something, and you know something has changed, go and see a doctor as soon as possible, because it's really important. The earlier you get treated, the more success people have in treating you. And today there's so many new options for treatment that it doesn't necessarily mean you have to have chemotherapy, because there's immunotherapy and other things that are happening today. So we try, that's why it's so important that we educate women about what's out there, what's new, and we don't give advice. We're just there to be a support system and make sure that women can make educated decisions.
And the other great thing about I.R.S is that we get you to the best breast cancer centers, best doctors, and it's amazing. They all want to help. I mean, almost categorically. You know, sometimes there's challenges with the hospitals, but the doctors and the nurses and everybody else, rock stars. So what can people do to help I.R.S and the non-profit? Donate. Well, where do they? Where do they
go to our website, which is I.R.S, AIRS Foundation.org, and you could make, apply to give us a grant. Any donation helps, whether it's $5 or $5,000. Everything goes to help a woman, and we keep our expenses really low because almost everyone who works with us, including me, are volunteers. So really very few of us get paid at all, so that we make sure all of our money goes to that. And if you want to apply for a grant, again, go to our website, I.R.S.Foundation.org, and apply for a grant. You'd be really surprised how many women don't have the internet and don't have the wherewithal, but there's an 800 number you can call, and somebody will help you fill out the application.
And go to the website at I.R.S. Foundation.
I.R.S.Foundation.org, and apply for a grant. It's very easy to do, and if you want to apply for a grant, that's also easy as well. You just hit apply for a grant, and it tells you exactly what to do and how to fill out the paperwork.
And if not, you can call the 1-800 number that's listed below.
Right.
Okay. All right, well, thank you so much.
Thank you.
Morgan, I really appreciate all you do. Giving back is very important for all of us as a human race, as physicians and people who care. Just remember, every day of every month is breast cancer awareness. Okay, so October just brings it to a different level. Thank you so much.